So we were asking the question of whether baseline cell-free DNA affects our ability to detect circulating tumor DNA, specifically for MRD or molecular residual disease. And the reason behind that is that we know that after surgery or other insults that could cause more inflammation in the body, that we have an increase in our natural cell-free DNA. And so that's expected. But what we didn't really know is when can we start reliably detecting ctDNA. So a lot of groups have waited for 4 weeks or a month after surgery to try and avoid any impact from the surgery on affecting cfDNA levels and ctDNA detection. But we really wanted to break that down into week buckets and see when was the correct time to start being able to reliably evaluate for ctDNA. So we looked at patients who had commercial tumor-informed ctDNA testing using the Signatera assay, and this was a real-world analysis, so it was ordered at whenever the provider felt like it was the necessary time point to do so. We identified 14,000 patients with colon cancer that was stage 1 to 3, and we excluded patients who had rectal cancer because of the potential impact of neoadjuvant therapy. And then we looked at patients who had at least one reliable ctDNA result. In the overall cohort, we weren't able to validate clinical features or confirm their surgery date in most cases, but we have a subset of 450 patients who had fully annotated results, and for them we were able to confirm their surgery date as well as chemotherapy administration. So that was our data set that we were working with. We then evaluated cell-free DNA in the overall and in the annotated cohorts. We noted an increase in cell-free DNA in 0 to 2 weeks, which would decrease in 2 to 4 weeks and further decrease in 4 to 8 weeks. But interestingly, these increases in cell-free DNA did not actually impact our ability to detect ctDNA. We saw a lot of variability, especially in week 1 and a little less so in week 2, but it seemed like we could fairly reliably detect ctDNA after week 2. So our conclusion from our analysis is that it seems like MRD testing could start as early as after 2 weeks from surgery.